Hello and welcome back to my YouTube channel. I'm Ruptalin and today I will be talking about the job roles of a nursing officer. So a lot of aspirants, even myself being an aspirant, I had doubt regarding the job role of a nursing officer. So in this video, I will be trying to clear your doubt regarding the job roles of a nursing officer. So let's dive into the job roles of a nursing officer at first. So once you qualify NORCET exam, you will be working as a nursing officer either in the ward setting, ICU, OT or in the OPD. So if you get posted in the OPD setting, you will be having a general shift that starts from 8:30 a.m. in the morning to 4:30 in the evening. You get off on Sundays plus any government holidays, and you doesn't have any night shift in the OPD setting. So if you get posted in the wards, ICUs or OTs, you have to work in 3 shifts, morning, evening and night shift. The morning shift starts from 7:30 a.m. in the morning to 2 o'clock in the afternoon. The evening shift starts from 1:30 p.m. in the afternoon to 8 o'clock at night, and the night shift starts from 8 o'clock at night to 8 o'clock in the morning. So these are the 3 shifts you will have to work as a nursing officer in the wards, ICUs or OTs. You get 8 days off in a month and 6 nights in a month. So I will be specifically talking about the job roles of nursing officer working in the ward and ICU settings. So the first thing I would like to talk about is vitals monitoring. So vitals monitoring is usually done in a 6-hourly basis for stable patients, and if the patient is on monitor, then it is usually done in an hourly basis. And the second thing I would like to talk about is medication administration. All forms of medications are usually administered by nursing officer in AIIMS, and they should have a very good knowledge of all the medications they are administering, the side effects, the adverse effect, as well as the therapeutic effect. So nursing officer have to have a very good command of all the medications they are administering, and the nursing officer are to have a very specialized knowledge regarding the medications that are usually administered in that particular department. And the third important thing I would like to talk about is documentation. As a nursing officer, documentation is very important. Any procedure or any findings have to be documented, and anything unusual should be informed to the on-duty doctor or to the senior staff. And another important thing is from admission to discharge, it is the responsibility of a nursing officer to maintain the documentation, to take the overall care of the patients, as well as documentation are to be maintained by the nursing officers. Another job role is sample collection. In some department it is done by the JR, but in some departments it is usually done by the nursing officer. Especially in the morning shift, all the investigations of the patients, including sample collection, chest x-rays, all the forms are to be filled and to be sent by the nursing officer. Another thing is inventories. In every shift, all the nursing officers have their assigned inventories, which need to be checked by every nursing officers in their particular shift to make sure that all the inventories are present. The last thing I would like to mention, and the most important thing, is need-based patient care. So the nursing officers have to decide what are the special needs of the patients that are to be fulfilled. There are some patients who require extra care. For example, patient having tracheostomy tube require periodical suctioning. For example, patient receiving inotropic drug requires continuous cardiac monitoring. Patient receiving diuretics requires their intake and output to be monitored. Patients having bed sore, patients having chest tube drainage, they require special care. So the need-based patient care has to be given by the nursing officer patient-wise depending on their need. For the nurses who are working in the ICUs, they need to be taken extra care of because they are taking care of patients who are very critical, and so they need to be extra careful and vigilant when they are on their duty. The nursing officer who are working in the OT setting should have a good knowledge of the instruments as well as the procedures they are assisting with. So there are different departments in AIIMS, and there are different procedures and medications that are used in that particular department. So nursing officer working in different departments should have a specialized knowledge of the procedures as well as the specialized medications depending upon the department they are working at. So these were the few job roles of a nursing officer working in AIIMS. So this was it for today's video. I hope you have learned something from this video. Do comment if you have anything that you want me to cover in my upcoming videos, and do like, share and subscribe to my channel for my upcoming videos. Till then, stay tuned, take care, bye bye.